Welcome to our training on bloodborne pathogens and the City of Portland's Exposure Control Plan. This training is required for all employees with potential occupational exposure to blood, other potentially infectious materials, and/or airborne pathogens. We will learn about what bloodborne pathogens and OPIM are, why they can be harmful, how to protect ourselves, and what the city's exposure control plan entails. If you have any questions throughout the training, please call the safety hotline to connect to a safety officer at 207-874-8622 or email safety@portlandmaine.gov. Let's get started. Part 1. Bloodborne Pathogens, Routes of Transmission and Illnesses of Concern. A pathogen is any microorganism that can cause disease, including viral, bacterial, fungal, or parasitic illnesses. Microorganisms enter the body through inhalation of air, ingestion of contaminated food or water, or direct blood contact. Bloodborne pathogens are microorganisms present in human blood or other potentially infectious material, or OPIM. OPIM includes semen, vaginal secretions, saliva in dental procedures, and other bodily fluids including cerebrospinal, synovial, pleural, pericardial, peritoneal, and amniotic fluids. OPIM also includes any unfixed tissue or organ other than intact skin from a living or dead human, as well as cell, tissue, or organ cultures or culture media containing HIV or HBV. Lastly, OPIM includes any bodily fluid visibly or potentially contaminated with blood, which can include vomit, feces, and spit. Bloodborne pathogens can enter the body through contaminated instrument injuries, such as needle sticks, through breaks in the skin such as cuts or lesions, and through the mucous membranes which include the eyes, nose, and mouth. After a potential exposure to bloodborne pathogens, the risk of infection depends on the pathogen involved, route of exposure, amount of infected blood, and its viral load, whether post-exposure treatment was taken, and the specific immune response of the individual. When it comes to the risk of infection from exposure to bloodborne pathogens, the primary diseases of concern are hepatitis B, hepatitis C, and HIV. Let's begin by talking more about hepatitis, which is a viral infection that attacks the liver. The liver is the large organ located in the upper right abdomen that works to remove toxins from the blood, digest fats, and assist in other bodily processes. Hepatitis causes inflammation, enlargement, and tenderness of the liver, and can cause liver damage that ranges from mild to severe and life-threatening. Individuals with hepatitis may experience shorter, acute, or long-term chronic infections. Although many people with hepatitis do not know they are infected, common symptoms of the virus include flu-like symptoms, fatigue, abdominal pain, loss of appetite, nausea, dark urine, and jaundice, which means a yellowing of the skin or eyes. Hepatitis B virus, or HBV, is a highly contagious strain of hepatitis that can live outside of the body in dried blood for 7 days or more. The CDC states that about 1 in 2 people with hepatitis B do not know that they are infected. There are no available medications to treat acute HBV, and there is no cure for chronic hepatitis B. There are treatments to slow or minimize the liver damage of those chronically infected with hepatitis B, and there is a vaccine available to prevent the transmission of HBV. Hepatitis C virus, or HCV, is the most common bloodborne infection in the U.S., and it's estimated that up to 4 million people in the U.S. had hepatitis C between 2017 and 2020. Many people with HCV do not know they are sick. There is no vaccine available to prevent hepatitis C virus, but it is fully curable for 95% of people with oral medication. HIV, or human immunodeficiency virus, is the other virus of concern when it comes to exposure to bloodborne pathogens. HIV, which does not survive long once outside the human body, is a virus that attacks the immune system. Without treatment, it can lead to AIDS, acquired immunodeficiency syndrome. There is currently no effective cure for HIV, but proper medical care can control the virus and allow people with HIV to live long, healthy lives. Within 2 to 4 weeks after an HIV infection, some people may experience flu-like symptoms, but others may not have any symptoms. Hepatitis and HIV can be transmitted through occupational exposures to infected blood, or OPIM, through breaks in the skin, the mucous membranes, and needle stick injuries. Transmission of these viruses can also occur through injection drug use, sex, birth, and for HIV specifically, through breastfeeding. Part 2. Exposure Controls. Luckily, there are many ways we can protect ourselves from potential occupational exposures to bloodborne pathogens. Occupational exposure means the reasonably anticipated broken skin, mucous membrane, or needle stick injury contact with blood, or OPIM, aka a potential exposure incident that may result from the performance of an employee's duties. What are some duties of your position that carry risk of occupational exposure to bloodborne pathogens? By implementing exposure controls, we can reduce risk of potential exposure incidents and keep ourselves and our coworkers safe. First, universal precautions is a system of infection control and an important exposure control that involves treating all human blood and OPIM as if it's infected with a bloodborne disease. Assume all blood and OPIM from others are infectious. This ensures that proper precautions be taken before, during, and after an incident involving blood or OPIM. Precautions include wearing personal protective equipment, washing hands thoroughly after any incidents involving blood or OPIM, and following safe handling and disposal practices for needles and sharps. Let's talk more about safe handling and disposal of needles and sharps, a responsibility that is held by only some positions at the city. You should never handle used sharps or needles if that is not part of your job responsibility. Instead, if you find a used needle, notify your supervisor or someone else who can assist with disposal. If you are responsible for handling needles or sharps, it is critical that you do so safely to avoid needle stick injuries. Needle sticks are serious OSHA recordable injuries that can result in the transmission of bloodborne pathogens. So what does safe handling of needles and sharps entail? 1. You must wear latex or nitrile gloves as personal protective equipment anytime you are handling needles or sharps. Some positions at the city are issued gloves with a needle stick resistance rating. If you are issued these as PPE, it is your responsibility to ensure that you wear them and care for them. 2. You must use mechanical devices such as tongs, grabbers, or pliers to pick up needles and sharps as opposed to using your hands. 3. Only dispose of needles or sharps in a sharps disposal container that is closable, puncture-resistant, and leak-proof. Sharps containers should be labeled with a biohazard sticker or color-coded red and should be kept upright and placed close to where sharps are disposed. Never dispose of needles or sharps in the trash. Sharps containers that are full or defective in any way should be replaced or reported immediately. Full or nearly full sharps containers should be brought to the city's Needle Exchange program at 39 Forest Avenue. You can also visit the Needle Exchange anytime you are in need of new sharps containers. Now, let's review a step-by-step protocol for picking up needles or sharps. Start by putting on gloves. You should always wear either latex or nitrile gloves, and thick needle-resistant gloves in some circumstances. Once you have your gloves on, ensure that you have a mechanical device like tongs, pliers, or grabbers to pick up the needle. Plant your sharps container on a flat surface near the location of the needle. Never hold a sharps container while trying to dispose of needles. Here, an employee is using a pair of tongs to pick up a needle. First, he grabs the needle and disposes of it tipped down in the sharps container, and then he disposes of the cap. You should never attempt to recap, bend, or snap needles when placing them in a sharps container, as this can increase your risk of a needle stick injury. Carefully pick up and dispose of each separate item with your mechanical device. You may need to wear thick needle stick resistant gloves in situations where there is an increased risk of contact with a needle, and your hands, such as if you are combing through brush in an area where needles may be present, sorting laundry, or searching bags. Here, an employee is wearing his needle stick resistant gloves since he had to move a branch that was partially covering a needle. No one should ever hand you a needle or place it in a sharps container that you are holding. Put the sharps container on a stable surface and ask the individual to safely dispose of it themselves. It is recommended to regularly disinfect mechanical devices used to handle sharps with a 10% bleach solution or other disinfectant, and needle stick resistant gloves according to manufacturer's instructions. After you are done safely disposing of needles and have removed your gloves, ensure that you wash or sanitize your hands thoroughly. Now let's move on to discuss some more exposure controls. It's important to help maintain a clean and sanitary workplace through the upkeep of regular cleaning or decontamination schedules and procedures. Use approved disinfectants and follow proper protocol for disposing of contaminated waste or bagging contaminated laundry. When cleaning up blood or OPIM on a surface, it's recommended to use a 10% bleach solution or other EPA-registered disinfectant. Saturate the affected area for 10 minutes and then thoroughly wipe the material up. properly dispose of any cleaning materials in a biohazard waste bin or bag, or by double bagging and placing the refuse in a waste bin or dumpster right away. Any specified work areas holding multiple sharps containers or other biohazardous waste, such as a storage room or bin, need to have a biohazard sign. Personal protective equipment, or PPE, is the last line of defense between you and bloodborne pathogens. There are many forms of PPE that can be utilized to prevent exposure, including gloves, eye and face protection, coveralls, boot covers, and resuscitation face shields. Your use of different PPE will depend on your task and its associated hazards. Never hesitate to speak up if you need new or replacement PPE. If you are wearing gloves that have blood or OPIM on them, take precautions when removing them to avoid getting anything on your skin, and always wash or sanitize your hands. The final exposure control we are going to discuss is the hepatitis B vaccine, which is effective for 95% of adults at preventing the transmission of the hepatitis B virus. The CDC states that the hepatitis B vaccine is safe and effective and the best way to prevent a hepatitis B infection. The hepatitis B virus can lead to serious, long-term, and incurable hepatitis B, an illness that damages the liver. The city offers this vaccine at no cost to all employees, with occupational exposure to bloodborne pathogens. The city offers a 2-shot series of Hepsilav B at the Portland Public Health Clinic, located at 39 Forest Avenue in Portland. After an initial shot, a second dose is administered after 30 days. If you are a new employee or if the city does not have a copy of this form in your record, you'll need to fill out a hepatitis B vaccine acceptance or declination form. This form can be found on the city's intranet page under the Human Resources section. Click on New Employee Orientation, and then find New Hire Paperwork in the list on the left-hand side of the screen. In New Hire Paperwork, there is a button called Hep B Vaccination Acceptance Declination Form. Once you have the DocuSign pulled up, please fill in your name, employee ID, job title, division, and department. Then choose one of 3 options to indicate your preferences about the vaccine. Let's review all 3 options, but first, don't forget to sign and date your form once you've made your selection. The first option says that you accept the vaccine and that you ask the city to arrange for you to receive the vaccine. You should select this option if you have never received the hepatitis B vaccine series before, or if you would like to get it again. If you are unsure if you've had the vaccine and want to check before accepting, you have a few options. You can reach out to your doctor's office to see if they can check for you, or if you have received vaccines in Maine, you can check your immunization records using the Docket app. You can access this app through the App Store on your phone or by visiting the Docket site on your computer. If you know that you have received immunizations in Maine but can't access them via Docket, you can also email vaccines@portlandmaine.gov and inquire as to whether they can find a record of a hepatitis B vaccine for you. If none of these options are feasible for you, you can get a titer or blood draw to test for hepatitis B immunity. You could also just choose to get the vaccine again because it is safe to receive the series more than once. The second option on the form says that you have previously received the hepatitis B vaccine. Select this option if you know you've received the vaccine at any point in your life. Some positions at the city may be asked to provide proof of vaccination. The third option on the form says that you do not wish to receive the hepatitis B vaccine. If you select this option, keep in mind that if at any point you change your mind and would like to receive the vaccine, you can let your supervisor or department's HR liaison know, and they can help you get set up with an appointment. If you are unvaccinated against hepatitis B and have an occupational exposure to bloodborne pathogens, the vaccine can be used as a post-exposure prophylaxis to prevent infection. If you accepted the vaccine, your department's HR liaison will be notified, so they can assist you in setting up a vaccination time at the Portland Public Health Clinic at 39 Forest Avenue. You can go to open vaccine hours or schedule an appointment by calling 207-874-8446. Be sure to let clinic staff know that you are a city employee. A few notes for seasonal employees: you can still receive the full series of the vaccine even if your employment contract with the City of Portland ends before series completion. We encourage seasonal employees to complete the full series. To support this, we will cover the full cost of the vaccine, including any shots administered after your employment period. It is your responsibility to ensure that you make it to both appointments. Part 3. Dealing with a potential exposure. Finally, let's talk about proper protocol if you experience a potential exposure incident at work. which would entail contact with someone else's blood or OPIM through a break in your skin, your mucous membranes, or a needle stick injury. First, wash or flush the area of your body involved in the exposure incident for 10 minutes. For skin exposures, thoroughly wash the affected area with soap and water. And for mucous membrane exposures, use clean water to irrigate or flush the affected area. If you have an eye wash station or saline bottles, you can use those to flush your eyes. After washing or flushing the affected area, report the exposure to your supervisor immediately so that they can fill out a first report of injury and take the appropriate next steps. You must be offered immediate medical evaluation at an occupational health provider or other medical provider after a potential exposure. Your care will be free and confidential. Your supervisor or department's HR liaison will call ahead to make an appointment for you. When you arrive, you will talk with the medical provider about what the potential exposure entailed, including the route of exposure, the amount of blood or OPIM involved, and any information you might have on the source of the blood or OPIM. Let's take a moment to discuss source testing. If the source of blood or OPIM involved in an exposure is known, the city can pursue source testing, which entails drawing blood from the source to identify potential bloodborne pathogens. The affected employee could then receive the results of the testing and would need to be informed on important laws relating to confidentiality for the source. Okay, back to the details of a medical appointment after a potential exposure. After the provider gathers information from you about the potential exposure and any other relevant medical history questions, they will likely draw baseline blood labs for HIV, hepatitis B antibodies, and hepatitis C. The provider may recommend treatments to prevent transmission of an infection if necessary. If unvaccinated against hepatitis B, the Hep B vaccine can be used as a post-exposure prophylaxis in addition to an immune globulin injection. It must be administered within 7 days to effectively prevent transmission. For high-risk exposures to HIV, the provider may recommend that you start a post-exposure prophylaxis within 72 hours of the potential exposure. HIV post-exposure prophylaxis medications are taken for 30 days, and blood panels are monitored throughout the course of treatment. Blood draws will occur at 6 weeks, 3 to 4 months, and then 6 months after the potential exposure to confirm that no infection has been acquired. You will have the opportunity to talk in depth with the provider, ask them questions, and express any concerns you might have about the risk level of the potential exposure and any recommended treatment. If you would like to speak with a counselor after a potential exposure, you can be referred to the Employee Assistance Program coordinator or another resource. You should be provided with a copy of the healthcare professional's written opinion within 15 days of evaluation. This documentation, as well as any other medical records pertaining to a potential exposure and/or the Hep B vaccine, are kept confidentially for the length of your employment plus 30 years. Part 4, Recap and Closure. Before we wrap up our Bloodborne Pathogens training, let's recap what we've learned. Bloodborne pathogens can be transmitted through occupational exposures to human blood, or OPIM, through breaks in the skin, the mucous membranes, or needle stick injuries. When a potential exposure occurs, there can be a risk of acquiring an infection to certain illnesses, including hepatitis and HIV. There are important exposure controls that can help protect us from exposures and their associated risks, including universal precautions, hand hygiene, regular cleaning and decontamination, safe needle handling practices, proper biohazard waste disposal, personal protective equipment, and the hepatitis B vaccine. If you do experience a potential exposure at work, start by flushing or washing the affected area, and then speak with your supervisor immediately. They will ensure you get immediate post-exposure medical care, where a healthcare provider can advise you on the best course of action to prevent infection. Thank you for your participation in this annually required Bloodborne Pathogens training. Your participation in this training will be recorded. Again, please reach out to the safety team if you have any questions by contacting 207-874-8622 or safety@portlandmaine.gov. Take care.